So, Mr. Morrone, what is telemedicine?
Telemedicine is the delivery of certain healthcare services in a non-face-to-face environment across a medium, kind of like Skype, where you see the physician and speak to the physician remotely, in some cases in the patient's home, and it allows access that very often wouldn't be accessible or convenient for the patient. Certain patients that have limited mobility, they can see their physician without having to arrange transportation, traveling to the physician's office.
Does there, in a telemedicine encounter between a doctor and a patient, does there have to be a pre-existing doctor-patient relationship, or can the initial encounter be by telemedicine?
Sure. Some states require it, even though, because it is the practice of medicine, they do require a existing physician-patient relationship. Other states allow the physician-patient relationship to be affected via telemedicine. Some insurance companies and payers will not reimburse for encounters that occur without a pre-existing physician-patient relationship.
What should a physician do to learn whether they can get paid for a telemedicine encounter?
Any physician that's contemplating engaging in telemedicine should review the policies of the various insurance companies that they're in network with, that they are contracted with. Most insurance companies will have some type of policy, and if not, they can contact the insurance company to find out what their policy is as far as paying for telemedicine encounters. Then, along those lines, many insurance companies have different requirements of what constitutes a valid telehealth encounter, what constitutes a valid physician-patient relationship, and what constitutes a valid prescription or order resulting from a telehealth encounter.
In terms of the rules for telemedicine, a lot of times with healthcare law, there's federal laws and there's state laws. Sometimes they conflict in the case of marijuana law, and sometimes they're inconsistent in more subtle ways. In terms of a doctor wanting to do telemedicine, do you look to state law or do you look to federal law or both?
Well, you look to both, but typically the practice of medicine is regulated primarily by the state, not the federal government. So physicians or any provider have to comport their behavior with their state licensing laws. Now, some states have laws specific to telehealth that deal with what can be done via telehealth, what constitutes a valid telehealth encounter, where other states don't. And if there isn't a law on point, then what we advise physicians is that if you do engage in telehealth in a state that doesn't have specific laws on point, that you review what the standard of care is, what is required for various diagnoses under your state's professional licensing laws, and comport your behavior to that. So, for example, if a visit requires a history and physical exam and a number of other criteria to constitute a valid office visit, then those same things need to be done via telehealth.
I noticed some of the states speak about this term originating site. Like some states require that the patient be located at an originating site. What is that? What is an originating site?
Not every location where the patient is physically present will allow telehealth. There are restrictions in some jurisdictions that require the patient to be in another healthcare facility or in a geographically distant area where there's less access to healthcare. So the metropolitan area, they may not be able to access telehealth. Not all telehealth encounters have to be primary encounters, meaning the physician is speaking to the patient for the first time or directly managing the patient. There are also telehealth encounters where, for example, the patient is with a primary care physician and in the primary care physician's office. And this is something that happens very often with medically underserved areas, where the telehealth encounter is occurring from one physician's office, which is the originating site, and the other physician is a specialist, for example. Let's say the patient requires a cardiologist, and the cardiologist is performing a consult without having the patient traveling hundreds of miles to the cardiologist's office for care.
Earlier in our discussion about telemedicine, you mentioned Skype, for example. Skype is a way that people communicate by video, or for example, on iPhone to FaceTime. Are there technical limitations on, for example, HIPAA and high tech, or some federal laws that deal with privacy and personal health information? Are there technical requirements, hardware requirements that deal with telemedicine?
Yeah. Yes. Generally, telehealth should only be performed via a secure portal or a secure system. Skype, FaceTime, and things like that are not really sufficiently secure from a privacy standpoint, because you are transmitting what's called protected health information. There is a degree of confidentiality that needs to exist, so it really does need to be on a secure platform.
Are these secure platforms generally available for physicians? What should they look to find this?
There's a variety of companies that provide telehealth, the technical component for telehealth. Some physicians may actually find that their electronic health records system that they have in their office may provide access to telehealth services, or as I mentioned, there are standalone companies that can provide those services.